Usually, when patients do not experience good functional outcome at 3 months, people tend to blame different factors for that. So it can be, oh, patient came in too late, or there was a large ischemic stroke at the admission, there was a hemorrhage afterwards, there was a tandem occlusion. So all of these factors have been previously reported and are known to be associated with bad outcome. But then there was also this recent meta-analysis on the no-reflow phenomenon, which is microvascular failure, which also reported that it would be associated with bad outcome. But then when we kind of dwelled deeper into the study, we saw that a lot of centers report kind of different results. Some say that microvascular hyperperfusion is associated with good outcome, some say it's associated with bad outcome. Same goes for microvascular hypoperfusion. And then we tried to kind of get the data from our center because we had a lot of patients and we could kind of match because we also we do per protocol perfusion imaging at admission and follow-up, so we could kind of really take a look at this microvascular status and see if that is related in any case to the outcome, because other studies, previous studies, have reported conflicting results. And we did look at that, and we kind of saw that this basically microvascular hyperperfusion, so increase in CBV and CBF perfusion maps, is related to having a higher likelihood of better outcome. Whereas microvascular hypoperfusion on CBV and CBF perfusion maps is related to having a lower likelihood of good functional outcome at 24 hours, 3 months, etc. And that was actually very interesting to kind of see these differences and discrepancies. And we identified basically 4 clusters, the normal perfusion cluster, hypoperfusion cluster, hyperperfusion cluster, and the mixed cluster. And then we saw that across these clusters, as I just said, that hyperperfusion clusters seem to do better. Sometimes this phenomenon is related to as luxury reperfusion, meaning there is an increase in cerebral blood flow and volume in the ischemic area, which would kind of make sense. But also, if we take a step back and remember what I just said about the no-reflow phenomenon, this microvascular failure, that would correspond to the microvascular hypoperfusion, and which was already reported to be associated with bad outcomes. So the results are kind of going in line with this, and we kind of hope that with this analysis, we can kind of now try to move into this direction, because the first studies on this microvascular status was in 1999 or even earlier. So no, this discussion has been really dragged out for 25 years or something now. And we really kind of wanted to see, okay, can we kind of stratify it? Can we kind of, because it's also important when you take a look at these microvascular patterns, okay, are these really responsible for the patient outcome which I'm seeing, or is it something else going on? So that was actually really exciting, and we were happy to kind of collaborate on that.